Okay, bi-level therapies, also called Bipap or Bpap. Some manufacturers will call it Vpap with the V as in Victor. They're electrically powered. This is just a review of what you already know. Um, they assist ventilation through providing a pressure on inspiration, which we call IPAP, and a pressure on expiration, which we call EPAP. There's two different modes. We can have BiPAP spontaneous, and this is where the patient takes their own breaths all the time. And then there's BiPAP ST mode, or spontaneous timed mode. And this is where the patient can take breaths on their own spontaneously if they want, but if they fail to take a breath, then the IPAP is delivered, forcing a breath to be taken. So in the picture to your right, you can see three different examples there. On the picture on the left with the blue wavy lines, that's normal breathing. Somebody who is not on a CPAP or advanced mode. They're just breathing in and out, inhalation, exhalation. The next example over is if they're on CPAP, and in this example, the patient is on 5 centimeters of water pressure of CPAP, and so when they take a breath in, they're breathing on top of that CPAP pressure. So they inspire on their own and they exhale on their own, but the pressure in their airway never goes below 5, okay, whatever the CPAP pressure is set. Now the next picture over is bi-level therapy, or BiPAP. In this you have two pressure sets, remember. Your IPAP, which is an increase in pressure on inspiration, and on this example it's set at 10. And then on expiration, they still breathe against a pressure, but it's a lower pressure. It needs to be at least 4 lower than the IPAP, and that's called your EPAP. So the difference between your IPAP and your EPAP is called pressure support. And the bigger the pressure support, the bigger the breath the patient will take. Okay? BiPAP settings, again, we're going to set an IPAP and an EPAP. Minimum starting pressure for BiPAP is 8 for IPAP and 4 for EPAP. So the minimum pressure support you can ever use with BiPAP is 4 centimeters of water pressure. So let's take a look at an example. Let's say we have our patient on 10/4, so 10 is the IPAP, 4 is the EPAP. This means their pressure support is 6 centimeters of water pressure. And let's say we measure their tidal volume, or how much air they moved in and out of their lungs in one breath, and we find out it's 326 milliliters. Well, if you remember from our previous lesson, normal tidal volume is about 500 milliliters. So with this patient, their tidal volume is still too low. They're still going to hypoventilate. So we need to make them take a bigger breath. So we would change our IPAP, and in this example, we're going to increase it to 12. We're going to leave EPAP the same because there's nothing in this example that we're talking about obstructive events, so we leave EPAP the same. So we have 12/4. This means our pressure support is now 8 centimeters of water pressure. So now we measure our tidal volume, and we see that our tidal volume is now increased to 440 milliliters. So, takeaway point from this example is pressure support is the difference between your IPAP and EPAP. The bigger the pressure support, the bigger the tidal volume will be. By increasing your IPAP, it makes larger breaths or larger tidal volumes. And EPAP is used to splint the airway open and preventing obstruction from airway collapse. BiPAP ST, this is a mode of BiPAP. In this mode, you would also set the respiratory rate. If the patient's respiratory rate falls below the set rate, then the BiPAP will deliver an IPAP pressure to make the patient take a breath to regulate their breathing. The indication for BiPAP is hypoventilation, and BiPAP ST is especially indicated if the patient's having central apneas along with hypoventilation, or they're having very low respiratory rates. That might occur with someone who is using opiates and causing their respiratory rate to decrease during sleep.